Hey guys, my name is Ashley. I am a CVT. If you've seen my videos before, you know that I haven't made a video in a really long time, and that's because I got a job. I passed my VTNE or VTNE, whatever, and I'm a CVT. I passed my state exam, and now I am working, which means that I'm busy. So I haven't been able to make a video in like 6 months. So today I wanted to talk about hyperthyroidism because I think that's going to be really helpful for you as well as for me when I'm at work. So let's get into it. Hyperthyroidism is a disease that we often see in internal medicine. Let's talk about the thyroid gland. So if we're thinking anatomy, the thyroid gland is where? Right here. So it's going to be in the cranial aspect of the lateral trachea. So it has two lobes, one on here and one on here. The pathophysiology of this is that your cat eats food. Your cat's food has iodine in it. That iodine is then synthesized by your thyroid gland, and your thyroid gland produces T3 and T4. And the T3 is called, I have to read it because I don't know how to speak English, tridothyronine, T3. T4 is thyroxine. These two hormones are what cause hyperthyroidism when they're being like overly produced by your thyroid gland. So let's keep going. In order to get a diagnosis on this cat for hyperthyroidism, you need to take in many things into consideration. So you need to know, obviously, how to diagnose. So you would want to do blood work, clinical signs, so how they look like at home, what's going on, what's making the owner come in and say, hey, this is X, Y, and Z is wrong with my cat, I need it fixed. As well as physical exam findings, so whatever your doctor is going to find when they are looking at the cat. So I say cat, and I don't know if I already said this, but cats are most commonly known to get hyperthyroidism. If a dog has hyperthyroidism, it means that they most likely have thyroid carcinoma. So keep that in mind. Dogs are more known to have hypothyroidism. So the physiological effects of hyperthyroidism in cats are that they're going to have increased metabolic rate, increased oxygen consumption, tachycardia, so increased heart rate. Their erythropoiesis is going to be jacked up, and their catecholamine response is also going to be jacked up. So what does that mean? Erythropoiesis, I'm pretty sure I've talked about this in other videos, but erythro just means like red blood cell, and then poiesis is just like the production of. So that just means that the stem cell going to a mature red blood cell, erythropoiesis. And then catecholamines are hormones made by your adrenal glands that include epinephrine, norepinephrine, and dopamine. Your adrenal glands, if you kind of like think about anatomy, are, you have your two kidneys, and then on top of it they have their little hats, and this is where your adrenal glands are. Boop, 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 and they create those hormones. Now that we have those physiological effects in our heads, let's think about the clinical signs that your owner is going to see as well as you're going to see when they come in to the hospital. So you're going to have your thyroid nodule or thyroid slip. So if there's enlargement of the thyroid, you can put your two fingers on either side and kind of pull down, and you're going to feel that slip of the thyroid. That's very common. You're going to have polyphagia with weight loss. So polyphagia is just increased appetite, and then weight loss is they're obviously eating more. Why aren't they gaining weight? They're losing weight quickly. There's something off. So this is increased metabolic rate. Remember the physiological effects. Then you have hyperactivity, hyperexcitability, increased vocalization, tachycardia. All these things are due to your catecholamine response. So catecholamines play an important part in your stress response in the body. So like I said, dopamine, norepinephrine, epinephrine, these things can cause increased heart rate tachycardia. You also have GI signs, which include vomiting, diarrhea, and increased fecal volume. So vomiting and diarrhea can be from a lot of different things, a lot of different diseases. You would usually see vomiting and diarrhea first, and then it kind of snowballs into all these other things. Increased fecal volume, that makes sense, right? Because if they're eating more, they're pooping more. PUPD. PU, polyuria, means increased frequency in urination, and then PD, polydipsia, is increased in their drinking, increased frequency in drinking. Like I said before, your heart rate is increased by your catecholamine response, and in turn you have heart murmur or a gallop. And this also includes thyrotoxic cardiomyopathy. So there's a lot of different things to think about with this disease. Hyperthyroidism is like surface level, and then there's a lot of other things underlying within that cat that they can have other diseases that are happening at the same time as hyperthyroidism. And other things that are happening because of the hyperthyroidism. So let's kind of like break it down, like unbox this whole situation mess of a disease. Heart murmur and gallop. So your cat is going to have an increased heart rate, and this is because of your catecholamine response. You also have your metabolic rate is going to be a little wonky, and your heart is going to try to keep up with that metabolic need, right? So your heart's going to be pumping, 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 and then your cardia muscles are going to thicken. This is, let's say, a part of the heart, ventricle or whatever. And then this is normal, and then this is going to be the thickening. And how do I do this? I guess like this. So you're going to have thickening, and with that thickening of the wall, there's going to be less space for there to be blood to come into. There's also going to be less blood to go out, and then there's also going to be less space for those valves that work in the heart to close appropriately. So that's where the heart murmur comes from, the like inappropriate closure of those valves, and that's what you're listening to when you're listening to their heart. So that includes a thyrotic, so caused by high thyroid cardiomyopathy and heart murmur. Now, PUPD can be explained in a lot of ways, but when a cat has hyperthyroidism, you want to make sure they don't also have kidney disease. And how do you do that? We'll talk about it more in a second. So, now, we've already talked about the physiological effects. We've already talked about the clinical features. We've talked that cats get it. When do cats usually get this disease? At what age? Do they get it when they're kittens? Do they get, like, when do they get it? That's probably a question. So that's a pretty good question for a VTNE. Cats usually get hyperthyroidism from middle age to older. The diagnosis for this is a serum total T4 level. That's the preferred screening, and you're gonna get anything greater than 4 micrograms per deciliter. In some cases, cats may be within normal limits to a little bit like high normal, and those cats can also be hyperthyroid, but you would want to just retest them. And this is why it's so important to know the clinical features, their history, all these physical exam findings, all these things together, because if not, then they can be misdiagnosed. So whenever cats do test like within that normal limits or just slightly above, this is called the gray zone. Closing this off a little bit, we're gonna have 3 treatment options, which are tested, tried, and true, but then there's an additional one that I would like to talk about because it's important to just know. You have 3, so you have medical, which is methimazole. This is just a drug that can be given orally or transdermally to cats, and this is a lifelong treatment. Because it's transdermal for the cat, it's also transdermal for you, so you would have to wear gloves, or the client, or whoever's doing it, and it should be taken into consideration. Other pets in the house, children in the house, because you don't want another cat grooming the cat that's hyperthyroid and then ingesting that, or a child touching, petting the cat and then getting that medication transdermally as well. So that's 1. 2, they can have excoriations, which is just like they are so itchy in that area where they're getting the medication that they start scratching, and then they can like open themselves up and get scabs and things like that. So they pretty much, it's like self-induced facial trauma. Surgical. So surgical is thyroidectomy. It's non-reversible. Obviously, you're not going to be able to put the thyroid glands back in there once they're out. So the thyroid glands are touching almost like on top of each other with the parathyroid gland. So what do the parathyroid glands produce that's really important for your body? Calcium. So your parathyroid glands produce calcium. So if, let's say, they're removing, excising, and they accidentally get a little bit of the parathyroid gland, or they just remove it completely, now your cat is hypocalcemic. Whoops. So it's something that can happen. Radioactive iodine, this is I-131. This treatment, I-131, is really good because it's a single dose. The process of it is that the cat who, let's say, has hyperthyroid comes into the hospital. They're given a subcutaneous injection. They stay in the hospital for days to weeks, depending on what like the radiation laws in the state are. And then they are sent home and hopefully live happily ever after until they pass away. Rest in peace, right? There are a lot of things to consider with this as well. So this radioactive iodine is usually a single dose. It's also non-reversible, but the thyroid glands can begin to grow and they can begin to become hyperthyroid again. But because most of the cats who are diagnosed with hyperthyroidism are usually middle-aged to like very old cats, it's very rare that your cat would become hyperthyroid again before they pass away, I guess. If I'm explaining that correctly. This does not have the risk of causing hypocalcemia, which is good. For 2 weeks after they get their treatment, they need to be kind of isolated within your house. So after they are cleared to go home, they're within the limit of, you know, the law requirement, you still need to put them in a small room or somewhere in your house where no one has access to it. And then you need to wear gloves when you're handling them. You can only handle them for about 30 minutes a day. They need to have flushable litter, so you can flush the litter after they're done using the bathroom, and their litter should be changed at least once a day. Anyone under the age of 18 is not allowed to touch the cat within that time period after the cat gets treatment. And then the last thing is a lifelong low iodine diet. I know Hills has one. It's called YD. It's like thyroid care or something like that. But the issue with this is that the amount of iodine needed to produce thyroid hormones is so small that like if your cat eats like a lizard or something, like the whole diet is like screwed. You know what I mean? Like it's a waste of time. And you have to keep a very close eye on your cat. If you have kids and they're feeding it, giving it treats, stuff like that, it's just not gonna work. It's not gonna work at all. So those are things to keep in mind. So now, any treatment is important to monitor renal function because it is common to have comorbid conditions and the presence or severity can be masked by hyperthyroidism. Before you do any irreversible treatment for your cat like a thyroidectomy or I-131, you should do a 2-week trial of methimazole, because with those 2 weeks you can see if your cat may be PUPD, they may begin to have high blood pressure, because with kidney function, your kidneys regulate your blood pressure. Your kidneys also regulate the production of your red blood cells. So if you do blood work and your cat is suddenly euthyroid or not hyperthyroid anymore because of the 2-week trial, but then your cat's BUN and creatinine, so kidney function values, are up. You have high blood pressure, a cat with high blood pressure, your cat is continuing the PUPD. What else do cats, they can become anemic because your kidneys, like I said, regulate red blood cell production. So if all these things start to happen, it's unreasonable to treat your cat for hyperthyroidism if all these other things are going to happen. After a 2-week trial, if you see all these different things happening, then your cat is no longer a good candidate for I-131 treatment. If you've already taken your VTNE and you've passed and you're just watching me just because like whatever, thank you, Illy, love you so much. If you haven't passed your VTNE and you're just watching to study, good luck, you're going to do great. Keep being positive. That's going to get you way further than studying your butt off and being stressed out all the time. I will talk to you guys next time. Bye!